How do you assess how the baby's doing? Well, it's a bigger challenge than you think. And accurate temperature assessments need to occur, but are they're variable points. So this core temperature, which would be some estimate of what the core is doing. We used to use rectal temperatures. Some estimate is probably appropriate. And then there's skin temperature, which is a probe on the skin. So some may use an axillary temperature and a skin temperature. It's important that they're not measuring the same thing. So the skin is measuring the temperature on the skin, and you're trying to assess the core. So as the skin temperature drops, the core may be maintained, and the difference is an important number so that you can sort of estimate how much the baby's trying to do to maintain the temperature. So the skin temperature is really low and the core temperature is higher. The baby is doing something to maintain that higher core temperature. And likewise, if the baby gets febrile, the skin temperature may actually be different than the core temperature, so the core temperature may be markedly higher than the skin temperature in that case. And people have looked at the difference between these two measurements as an indicator of how the baby is doing. So you have to look at how you're measuring the baby. Obviously, issues of probes falling off and not being accurate are important to assess and to help to manage. So thermal assessment is something that has to go on regularly, continuously, and be part of all protocols, particularly as the babies are preterms. Now, what if the baby is getting cold? How do you know the baby is getting cold? Babies do show some signs of being cold, but many of these signs are confused with other signs. So a baby can act sick, and it could just be that they're cold. They can be restless, have abdominal distension, be vomiting, shallow, irregular breathing. They can have respiratory symptoms like grunting and an apnea, bradycardia, all due to being cold. And many times in the delivery room, for instance, you'll have a baby that's just not acting right, may not be pinking up or may not be breathing comfortably, and you just find out the temperature is really bad, really cold or really hot, and that may be all that's going on. So these are symptoms that are very general, hard to distinguish, but as a baby is acting in a way that you're not pleased with or is acting differently, temperature is a consideration. And certainly can be one of the first things to consider when evaluating a baby. And many of these symptoms are caused by this incredibly robust response to cold. So the body does not like to be too cold or too hot, and you can see from this slide that lots of things go on. So one of the first things the baby will do when the baby's cold is they will constrict their blood vessels. And so as you constrict your blood vessels, the hands and feet may look blue. And so the baby will look cyanotic when in fact the baby may have a normal oxygen content, but the baby just is shutting down. The baby will become mottled, which can be very disturbing. And that is due to peripheral vasoconstriction. That in time will increase acidosis and will cause systemic problems, which are on the left side, which may have started off by having their adrenaline norepinephrine kick in. That also causes pulmonary vasoconstriction. So you can see as you move down this slide, you get more and more physiologic and more trouble. So babies could get being exceptionally unstable just by the basis of being cold, and this cascade of events that's occurred to cause them real physiologic responses as they're trying to maintain temperature. And so a sick baby, again, could be just in a thermal environment that is not suitable to them. And that, again, can be changing on a frequent basis, so it's something to be considered. I've seen babies that are preterm and the door was left open in the incubator, and you come in and babies having apnea and bradycardia and find out the temperature is just too low, and that's all that's wrong with the baby. So they can respond very violently to being cold. And in addition, they can respond relatively violently to being hot. So they can start acting, they can have poor feeding and irritability, their tone can change, they can become lethargic, their skin can get bright red as it gets vasodilated, and their vital signs can change. Their heart rate can change, their respiratory rate can change. And so there are many times that a baby is just a little too warm, the incubator is set wrong, or the skin probe fell off, and the baby will start to act very abnormally based on temperature. So again, this is one of the vital signs of the baby, the temperature, both core and skin, something that should be considered. Mistakes can be made, the baby can change. All this has to be a daily consideration, and one of the reasons why babies need to be closely monitored in an intensive care unit when they're in an incubator or in a warmer or preterm and at risk for heat abnormalities. Now, one of the challenges for all of us is we've come a long way. We have incubators that are very fancy now that do lots of things that can servo control your temperature, that can impact on the amount of convection and conduction. And there's double walls, and there's all sorts of portals and great humidity systems. And so we think we're doing great in terms of thermoregulation, but we've also seen babies that still get cold sometimes and get warm sometimes, transition from open environments to closed environments. And what is the impact on them long term for all these changes? And the answer really is we don't know. Again, it was the single greatest advance in the care of preterm infants, and is a little warming enough, or is perfect warming in a perfect thermoneutral environment the best way to be? And how important is it to be there? And I think, personal opinion here, that there are dramatic alterations in outcome based on our management of their environment. And I say that for a couple reasons. One is that we have studied incubator weaning, which I'll show in the end, that does suggest that how we wean the incubator impacts dramatically on how the baby does. And I'll show some of that data. But I think, for me, the biggest concern is when we test incubators in animal studies in the laboratory. And in preterm animals, if you heat them or cool them ineffectively, they will have very, very serious reactions. So cerebral blood flow changes, cardiac output will change, and even death can occur relatively quickly just by being a little too cold and too hot. We don't see that in babies. Babies will seem to get sick and then seem to recover. But we know from studies on head cooling that rapid rewarming is not a good thing, rapid cooling is not a good thing, and thermostress can be very challenging from a physiologic point of view. And so my guess is that we make mistakes in thermoregulation. That is something that we should be challenging ourselves and re-challenging ourselves to get right, because a baby in a bad environment will adapt and will look like they've done okay, but are there complications due to being a little too cold or dramatically cold or dramatically rewarmed? I mean, if you put a baby from a nice warm incubator onto an open scale, you put them back in the incubator, we know they get cold. We've seen their temperature drop, and our response is just warm them up. Are we warming up too fast? Is that environment, is that change so stressful that we've affected their long-term outcome? We believe that there will be metabolic stresses on the baby in terms of weight loss or metabolic rate, but is there an increase in complications? I don't know, but it is a little bit scary to think about. So the long-term impact of this cardiovascular instability that we've all seen in babies as they get too cold or too warm or get rewarmed is concern for long-term outcomes. And it's just something that you should think about. And as we work on or rework our ability to manage these babies in terms of thermoregulation, maybe we're doing a lot more for them than both short-term and long-term than we have guessed or thought of in the past. Recent research has given us pause in terms of our approach to the management of babies in their incubators. And so what we've learned recently is that there's a great deal of unwarranted variation in how babies leave the incubators due to nursing style and physician style and our approach to this, and not really honing in on this as a vital sign. And so what we've learned is that certainly in the acute environment, how we wean an incubator will impact on their length of stay, their ability to feed, their ability to go home, and certainly costs in the nursery. The earlier you get them out, likely the cheaper the stay is, and the quicker they're home with the mom, which is where you want them. We also know that the vital signs in the very early stages, the war loss, etc., is importantly impacted by the neutral thermal environment. So critical in terms of early on management of the baby, as well as the baby progresses through the nursery stay. What we know less about, quite frankly, is the long-term impact of our management of the incubation and heating of babies and humidification of babies in terms of how they're doing 10, 20 years out as they move through childhood. But there is a fear that these huge instabilities that we can see in the animal world when we test them, and even the subtle instabilities of rewarming and cooling, of things like moving in and out of an incubator to a warm bed environment where the baby's temperature is not in the neutral thermal environment for a short period of times. The changes that we see in terms of cerebral blood flow, in terms of cardiac output, in terms of sepsis workups, from all due to thermo changes, may have long-term impacts. Certainly we know the short-term impacts are there, but do they have long-term impacts? It's a concern of mine. Do we have data? We don't, but it is my suspicion that if we fine-tune this incredibly important tool and this vital sign of temperature, that we will have long-term as well as short-term impact on the outcomes of these babies.